If you're exhausted, if you're foggy, if you're feeling anxious and your labs keep coming back normal, this video is for you. You're not broken, but there's a very good chance the system you've been relying on was never designed to actually make you well. In the next few minutes, I'm going to walk you through the 5 brain and body truths I wish every patient knew. These come from years of treating thousands of people, and once you see them, you will never look at your health the same way again. You've done everything you were told: doctors, meds, therapy, diet, supplements, yet you still feel off, tired, wired, not yourself. And the worst part is being told everything is normal when you know it's not. I'm Dr. Raj Langani. I'm a double board certified psychiatrist in both adult and child and adolescent psychiatry, and an integrative mental health and longevity physician. I've treated thousands of patients, and I've seen the same patterns show up again and again. I'm going to walk you through the 5 truths that most people, and honestly most providers, completely overlook. And by the end, you will understand exactly why you have been stuck and what actually needs to change. Point 1, your brain and body are one system, not 2. Most of medicine treats the brain and the body as if they live in totally separate zip codes. You see a therapist for your mindset, you visit a wellness clinic for your hormones, everyone works in their own silo and nobody talks to each other. The result is that you get 5 different opinions and 0 coordination. But your brain and your body do not operate in silos. They are one connected system. When your metabolism is off, your mood suffers. When your sleep is broken, your focus collapses. And when your hormones shift, your anxiety spikes. You cannot just fix one without addressing the other. Here's the part nobody tells you. You have not failed at getting better. You've been getting care from a system that was designed for throughput, not transformation. And I see this constantly. A patient comes to me after seeing 3 or 4 providers. One puts her on an antidepressant, another told her the labs were normal, a third recommended meditation. Nobody looked at the full picture. Nobody connected the dots, and she is left wondering why she still feels terrible despite doing everything she was told. Imagine your car breaks down. You take it to one mechanic, and they look at the engine, and another one checks the tires, and a third one tests the battery, and they each say their part looks fine, but the car still does not run. That's what fragmented healthcare does to people. And that leads directly to the second thing I wish everyone understood, because it explains why so many people are told they're fine when they clearly are not. One of the most damaging things I hear patients say is this: my labs came back normal, so I guess I'm fine. Normal lab ranges are based on population averages. They tell you whether you fall within a statistical range. They do not tell you whether you're actually well. There's a massive difference between surviving, functioning, and truly thriving. Most people are stuck somewhere in the middle. They're not sick enough for diagnosis, but they're nowhere near their potential. You're in no man's land. And because your numbers fall in the normal range, they're told nothing is wrong. So they start to doubt themselves. And if you feel off, something is off. Do not let a normal lab result convince you otherwise. I've had patients come to me after being told their thyroid's fine, their blood work's fine, their vitals are fine, but they're exhausted, anxious, gaining weight, cannot think straight. When we actually dig deeper with the right testing and look at the full system, we find real answers: hormone imbalances, insulin resistance, nutrient deficiencies, pharmacogenomic mismatches with your current medications. These things do not show up on a standard panel, but they're driving the symptoms. If you have been told everything looks normal, but you do not feel normal, that's not the end of the conversation. That's just the beginning. And it means you may need a provider who's willing to look deeper and connect the dots and actually listen. But even when you find the right provider, there's a third truth that most people get completely wrong and is quietly keeping millions of people stuck. If any of this is clicking for you, if you are realizing that maybe the reason nothing has fully worked is because nobody has looked at the full picture, that's exactly what this channel is about. I break down the real science behind your brain, your body, and how they can work together so you can finally stop guessing and start getting real answers. Subscribe so you don't miss what's coming next. Point 3, you cannot think your way out of a body problem. This one might surprise you. For many patients, the fastest path to better mental health is not more therapy, more medication, or more mindset work. It's fixing the body first. Early in my career, I believed psychiatry alone could solve most mental health problems. I do not believe that anymore. What I've seen over and over is that when sleep is broken, when metabolism's off, when hormones are out of balance, when the nervous system's stuck in overdrive, no amount of talk therapy or willpower is going to fully resolve what you're feeling. The body has to come online before the mind can follow. I cannot tell you how many patients I've treated where we addressed sleep quality, improved their metabolic function, corrected a hormone imbalance, or simply got them on the right medication using pharmacogenomic testing, and their anxiety, depression, or brain fog improved dramatically. Not because we ignored the mental health piece, but because we stopped treating it in isolation. Ask yourself these 3 questions honestly. 1, have I been in therapy or on medication for months and still feel like something's missing? 2nd, do my symptoms shift with my sleep, my cycle, my stress level, or my energy in ways that feel unpredictable? Third, have I ever had a thorough evaluation that looked at my sleep, hormones, metabolism, inflammation, and mental health altogether? If you answered yes to the first two and no to the third, there's a very good chance your body's sending signals that have never been properly read. Now, understanding that the body matters is one thing, but knowing what to actually do with that information is where most people get lost. And that brings us to something that could save you years of spinning your wheels. Point 4, precision beats volume every single time. More is not better. More medications, more supplements, more therapy sessions, more biohacks, more without direction just keeps you busy while keeping you stuck. One of the biggest mistakes I see is people stacking interventions without a strategy. They're on 3 supplements from an influencer, 2 medications from different doctors, doing a new diet every single month, and wondering why nothing's working. The answer is almost never to add more. The answer is to get precise. That means understanding your specific biology, your genetics, your hormone profile, your nervous system patterns, and building a plan around that, not working around what worked for someone on social media. This is exactly why I use pharmacogenomic testing in my practice. Instead of guessing which medication might work and cycling through trial after error, we can look at how your body actually metabolizes different drugs and make informed decisions from the start using your genetic data. That alone saves patients months or even years of frustration. The same applies to supplements, peptides, and lifestyle interventions. Personalization is not a luxury. It's the difference between progress and just spinning your wheels. If you are currently taking supplements or medications prescribed by different providers who do not communicate with each other, that's your first red flag. If you're following a health protocol based on what a podcast recommended without knowing your own labs, that's your second. And the next step is not to add anything new. It's to find a provider who will actually look everything you're currently doing through the lens of your specific biology and help you subtract what's not working before layering on more. And all of this leads to the single most important truth I can share with you. One that I wish someone had told me years ago because it would have changed my approach to everything. Point 5, real healing lives in the middle. The truth is not at the extremes. It never has been. And yet almost everything you hear about health pushes you toward one end or the other. You are told it's all in your head or it's all physical. You need more discipline or you need more self-compassion. Push harder, slow down completely, medicate everything, go fully natural. But real healing does not live in any of those extremes. It lives in integration. Awareness combined with action, science combined with humanity, effort combining with recovery. And this is my core philosophy, and I have watched it transform patients who have spent years bouncing between extremes without ever landing on something sustainable. The people who get lasting results are the ones who stop looking for the single magic answer and start building a connected, personalized approach that honors both the brain and the body at the same time. Think of it like tuning an instrument. If you only tune one string, the whole thing sounds off. You have to tune the full instrument. Your sleep, your nutrition, your movement, your stress response, your hormones, your mental health. They all have to be brought into alignment together, right? Not perfectly, not all at once, but intentionally and with awareness. Tonight, I want you to do one thing. Before bed, take 5 minutes and write down the answer to this one question. Where am I being treated in pieces right now? Which providers am I seeing or do not talk to each other? Which symptoms am I managing separately that might actually be connected? Where have I been told I'm just fine, but know something's still off? This isn't about diagnosing yourself. This is about seeing the full picture clearly for maybe the first time. Because once you see it, you cannot unsee it. And that clarity is the first real step toward getting the integrated, personalized care you actually deserve. This is my final thought. You are not broken. You've not failed. You've simply been inside a system that was never built to treat you as a whole person. And the fact that you watched this far tells me you already know something needs to change. Trust that instinct. Your brain and your body are one system. And when you finally start treating them that way, everything shifts. If this resonated, the next video I'd watch is the one on why so many high performers feel anxious for no reason, even when life looks fine from the outside. It's on screen now. Click it and I'll show you exactly what's driving it and what to do next.